Have you ever thought that something as simple as personal hygiene could be sending silent signals about your health? I know it sounds surprising. Most of us think brushing our teeth, trimming our nails, or taking a shower is just part of the daily routine. But what if I told you that doctors can sometimes spot life-threatening conditions just by looking at how well or how poorly you take care of yourself? The truth is, experienced physicians often recognize early signs of heart disease, kidney problems, or even dementia just by noticing small hygiene mistakes in their older patients. And here's what's even more surprising: most seniors have no idea they're doing anything wrong. These mistakes are easy to overlook, and many seem harmless. But your body is constantly trying to communicate with you, and hygiene is one of the ways it does that. Let me tell you about Carl. Carl is 74 years old. He's a retired high school coach, still active, still sharp. He walks every morning, keeps up with yard work, plays cards with his buddies on the weekend. In short, he felt perfectly fine. But during a routine checkup, his doctor noticed something odd. Carl's skin looked unusually dry, and his nails had slight discoloration. Now, most people wouldn't think twice about it, but his doctor did. After some tests, they discovered Carl was showing early signs of a circulatory issue. Left untreated, it could have led to a serious, even life-threatening condition. Carl later told me, "I had no idea. Honestly, I came so close to missing something that could have changed everything. And that's why this matters." In today's video, I'm going to walk you through 7 of the most common personal hygiene mistakes older adults make, the same ones doctors pick up on in seconds, and I'll show you exactly how to fix them. This isn't just about staying clean, it's about protecting your independence, your well-being, even your life. If you're over 60 or you care for someone who is, this video could make a real difference, so stay with me until the end. And before we dive in, let me ask you, when was the last time your doctor talked to you about your hygiene? Have you ever dismissed a small change in your body because it just comes with age? Drop your thoughts in the comments, I read every one. And if this resonates with you, please hit that like button and subscribe for more life-saving tips on aging well. Let's get into it. Mistake number 1, neglecting oral hygiene. Let me ask you something personal but important. When was the last time you really paid attention to your oral hygiene? And I don't mean just brushing out of habit, half asleep in the morning. I mean, when did you last think about what your mouth might be trying to tell you? Because here's the truth most people don't realize. Your mouth can be a mirror to your overall health. And when oral hygiene is neglected, it doesn't just lead to cavities or bad breath. It can open the door to serious conditions like heart disease, stroke, and even memory loss. Let me explain. When you don't floss or brush properly, bacteria builds up along the gum line. Over time, that bacteria can cause your gums to bleed, something many of us brush off as normal. But that bleeding, it's a sign that bacteria may be entering your bloodstream, quietly making its way to your heart and other organs. Sounds scary, right? That's because it is. Take Helen, for example. She's 71, a widow from New Jersey. Every morning, she brushed her teeth, but at night, she was tired, and flossing just felt like one more thing to do. She noticed a little bleeding here and there but thought, it's probably just my gums getting older. At her next doctor's visit, though, the story changed. Her physician noticed signs of chronic gum inflammation and sent her for tests. The results, early indicators of heart disease. Thankfully, they caught it early, but just a few more months, and the damage might have been permanent. So here's what you can do starting today. Replace your toothbrush every 3 months, or sooner if it's worn. If possible, switch to an electric toothbrush, they remove more plaque. Brush twice a day for at least 2 full minutes. And yes, floss every single night, no excuses. Watch for bleeding, swelling, or sensitivity in your gums. These aren't just age-related, they're warning signs. Tell me in the comments, do your gums bleed when brushing? Have you been skipping the floss? It's easy to overlook the small things, especially when life gets busy. But your mouth might be trying to get your attention, not for cosmetic reasons, but for your heart, your brain, your future. If this struck a chord with you, hit that like button, share it with a loved one over 60, and stick with me. We've got 6 more vital hygiene mistakes to uncover. And trust me, you won't want to miss number 4. Mistake number 2, infrequent bathing and skincare. Let me ask you a simple question. How often do you bathe these days? And more importantly, when you do Do you take a moment to actually look at your skin? Because your skin isn't just a surface to keep clean. It's your body's largest organ, and believe it or not, it's often the first place your health tries to speak up. As we get older, it's easy to bathe less often, especially if you're not sweating much or staying home most days. Joint pain, fear of slipping, or just not feeling like it all adds up. But here's the danger. Skipping baths can mean missing early signs of serious health problems. Let me tell you about Norman, a 78-year-old retired mechanic from Ohio. During the colder months, Norman started cutting back on showers just once a week. He figured, why bother? I'm not dirty, and I don't go out much. He also thought bathing less might help his dry skin. But during a checkup for an unrelated issue, his doctor noticed blotchy discoloration on his back and legs. That seemingly minor change led to a deeper investigation and revealed early-stage kidney dysfunction. That patchy skin was one of the few outward signs his body was trying to give him. Now here's the thing, Norman wasn't careless. He simply didn't know his skin was warning him. So what can you do to protect yourself or someone you love? Aim to bathe at least 3 times a week, even if you don't think you need it. Use a gentle, fragrance-free soap to avoid stripping away your skin's natural oils. Right after bathing, while your skin is still a little damp, apply a good moisturizer. This locks in hydration and helps maintain your skin barrier. And most importantly, look at your skin. Notice anything odd. Red patches, unusual spots, persistent itching, or dry areas that never heal. Don't ignore them. Your skin could be whispering that something's not right inside. Let me ask you, when was the last time you looked closely at your back, legs, or feet? Have you ever noticed a change but brushed it off? Drop your answers in the comments, I'd love to hear. Taking care of your skin is more than vanity. It's about listening to your body's early warning system. And the earlier you catch the signs, the better your chances of staying healthy, independent, and strong. Stick with me, there's much more to uncover in the next section, and trust me, it only gets more eye-opening from here. Mistake number 3, ignoring nail care. Here's something you might not think about every day. When was the last time you really looked at your nails? Not just trimming them to stay neat, but truly looking the shape, the color, the thickness. Do they seem different lately? Most people don't realize this, but your nails can reveal a lot about what's happening inside your body. Yes, your fingernails and toenails are more than cosmetic. They're like little messengers, quietly signaling conditions like anemia, thyroid imbalance, liver issues, and even heart problems. According to the American Academy of Dermatology, 1 in 3 nail abnormalities in people over 65 is linked to an internal health condition. That's not something to ignore. Let me share Irene's story. She's 81 and a retired librarian from Pennsylvania. For months, she noticed her toenails getting thicker and turning yellowish. She assumed it was just old age, so she hid them in socks and closed-toe shoes and told no one. But as time went on, the nails got worse. When she finally saw a foot specialist due to pain while walking, the doctor diagnosed a fungal infection and, more importantly, tests revealed that her immune system was suppressed. What started as a nail issue turned out to be her body crying for help. So how can you avoid this kind of silent risk? First, trim your nails straight across, with slightly rounded edges to prevent ingrown nails. Keep them clean and dry, especially your toenails. Change socks daily, and wear breathable shoes that allow your feet to stay dry. Most importantly, don't ignore changes. Thickened nails, yellowing, brittleness, ridges, or pain could be signals of something deeper. I want to hear from you. Have you ever noticed changes in your nails and just brushed it off? Do you regularly check your toenails or only when there's discomfort? The truth is, your nails are whispering to you. Are you listening? Catching the signs early doesn't just prevent discomfort, it could uncover a serious condition before it becomes life-altering. So the next time you're clipping your nails, pause, take a good look. That small habit might just save your health. And if this made you think twice about nail care, hit that like button, share it with someone who needs to hear this, and stay with me because in the next section, we'll cover a hygiene mistake that affects millions, but almost nobody wants to talk about. Mistake number 4, improper incontinence management. Let's talk about something that affects millions of older adults, but almost never gets discussed: incontinence. Over 50% of people over the age of 65 experience some form of bladder leakage. Yet, most suffer in silence. Why? One word: shame. They don't want to talk about it, not with family, not with friends, and sometimes not even with their doctor. But here's the truth. Hiding it doesn't make it go away. In fact, it often makes things worse. When people try to manage incontinence on their own using paper towels, extra layers of clothing, or avoiding going out altogether, they put themselves at serious risk. We're talking skin breakdown, recurring infections, and even dangerous falls from rushing to the bathroom. Let me introduce you to Walter, a 74-year-old retired bus driver from Indiana. For almost a year, Walter dealt with light bladder leakage, but he kept it a secret. "I didn't want anyone to think I was losing control," he admitted. He used tissues, changed his clothes constantly, and avoided long outings. But by the time he finally talked to a doctor, he had developed painful skin sores and repeated infections. Tests revealed an undiagnosed prostate condition, something that could have been treated early if he'd spoken up sooner. So what's the lesson here? Incontinence isn't a moral failing. It's not a sign of weakness. It's a medical issue, and it's more common than you think. And thankfully, there are solutions. First, talk to your doctor. They've seen it all. There's no need to be embarrassed. Use products specifically designed for incontinence. They're safer, more absorbent, and protect your skin. If an accident happens, cleanse the skin gently to prevent irritation and infection. And most importantly, don't wait. The longer you hide it, the harder it gets to treat. I want to hear from you. Why do you think so many older adults stay silent about incontinence? What would help reduce that shame? The truth is, we need to change the conversation. Incontinence should be discussed with the same honesty we give to blood pressure, cholesterol, or arthritis. When we break the silence, we create room for support, dignity, and better health outcomes, not just for ourselves, but for the people we love. If this message resonated with you, give it a thumbs up and share it with someone who may be quietly going through this. You might help more than you know. Mistake number 5, ear hygiene errors. Let's talk about something most of us were never really taught how to do properly: cleaning our ears. Be honest. Do you use cotton swabs after a shower? Maybe twist them just a little deeper than you should, thinking you're keeping your ears clean. If that sounds familiar, you're not alone, but you might be doing more harm than good. In fact, doctors say that nearly 40% of ear injuries in older adults come from at-home cleaning. Yes, 40%. That's a huge number for something that's supposed to be part of our hygiene routine. The scary part: these injuries can lead to infections, permanent hearing damage, and even punctured eardrums. Let me share Elaine's story. Elaine, a 72-year-old retired piano teacher from Oregon, took pride in staying clean. After every shower, she'd reach for her trusty cotton swabs just like she had done for decades. But one day, she went a little too deep. "I felt this sharp pain, and then a weird ringing," she said. Elaine had accidentally punctured her eardrum. The infection that followed damaged nearby tissue, and today, she lives with partial hearing loss in one ear, all from a routine she thought was helping. So, what can we learn from this? First, your ears clean themselves. The wax, or cerumen, that builds up in the ear canal actually protects your inner ear from dust and bacteria. Most of the time, it slowly moves out on its own. So instead of reaching inside, use a warm, damp washcloth to gently wipe the outer ear. If you feel like there's too much wax, you can try over-the-counter ear drops, but always follow the instructions. And if you're experiencing itching, pressure, hearing loss, or any kind of discharge, don't self-diagnose. See a doctor or an ENT specialist. Now let me ask you, have you ever used a cotton swab inside your ears, thinking it was safe? What would it take for you to break that habit? Your hearing is precious. And for many, once it's gone, it doesn't come back. Let's treat our ears with the same care we give to our eyes, our heart, or our skin. If this message helped you think differently about something so small but so important, hit that like button, and share it with someone you care about. And don't go away, because next, we'll look at another hygiene mistake hiding in plain sight: your feet. You won't believe what they can reveal about your health. Mistake number 6, poor foot hygiene. Let's talk about one of the most overlooked parts of the body: your feet. We rely on them every single day, yet many people, especially as they age, stop giving them the care and attention they deserve. What most don't realize is that your feet can quietly reveal the first signs of serious internal health problems like diabetes, poor circulation, and nerve damage. In fact, doctors specializing in elder care often start with a foot exam. Why? Because the skin, color, temperature, and sensation in your feet often change before other symptoms even appear. According to the American Geriatric Foot Health Association, over 80% of serious foot-related complications in older adults could be prevented just by practicing simple, consistent foot hygiene and daily inspection. Let me share Walter's story. Walter, a 74-year-old retired school janitor from Georgia, had always been active. But over time, he got into the habit of keeping his socks on all day even around the house. He didn't think much about his feet. Dryness, just part of aging. Dark spots, probably nothing. But during a routine home visit, a nurse noticed unusual discoloration on one of his feet. After tests, doctors discovered Walter had early-stage diabetes and severe circulation issues. He hadn't even noticed that his toes felt colder, or that a small sore wasn't healing. Thanks to early detection, Walter avoided a much worse outcome, one that could have ended in surgery or even amputation. So what does proper foot hygiene look like? It starts with washing your feet thoroughly every single day, especially between the toes. Then, dry them gently but completely, paying close attention to areas where moisture might get trapped. This step alone can prevent fungal infections and skin breakdown. After washing, use a gentle moisturizer to keep the skin soft and prevent cracks. Just avoid applying lotion between the toes, where trapped moisture can cause problems. Wearing clean, breathable socks made of moisture-wicking fabric can also make a big difference, especially if you're on your feet for long periods. And don't forget to inspect your feet daily. Look for cuts, swelling, blisters, or any changes in color or temperature. These aren't just minor issues, they're signals from your body that something deeper might be going on. Taking care of your feet isn't just about comfort. It's about preserving your mobility, independence, and quality of life, one careful step at a time. Mistake number 7, medication-related hygiene changes. Sometimes, the changes we notice in our body seem small, like a new kind of body odor, or feeling unusually sweaty, or having a mouth so dry that even water doesn't help. Many people brush these things off. Maybe it's the weather. Maybe it's just aging. But here's something you might not know. For nearly 40% of older adults, the first signs of medication-related problems don't come through pain or visible illness. They come through subtle changes in personal hygiene, things like altered body scent, dry or irritated skin, or abnormal sweating. These aren't just quirks. They can be your body's quiet way of saying, something's not right. Let me tell you about Joanne, a 69-year-old retired piano teacher from Oregon. She was meticulous about her hygiene. She wore clean, well-kept clothes. She showered daily, used gentle soaps, and never skipped brushing her teeth. But over time, her daughter noticed something strange, a persistent, unfamiliar odor that no amount of cleaning could get rid of. They thought it was just part of getting older. But when Joanne finally brought it up with her doctor, deeper tests revealed the real cause. Her liver was under stress from one of her prescription medications. It wasn't a hygiene issue at all, it was a metabolic change, triggered by her body processing that drug. Fortunately, with some medication adjustments and support for her liver, Joanne's symptoms began to fade. But had she ignored it or tried to fix it on her own, the situation could have grown far more serious. That's why it's so important to track these hygiene-related changes. If you're noticing unusual body odor, sweating when you're at rest, dry mouth that makes it hard to swallow or speak, or skin changes that don't seem connected to your normal routine, it might not be your soap. It might be your medication. Simple steps can make a big difference. Stay well hydrated, especially if your medication affects your metabolism. Avoid skipping meals, since food can help buffer your body's response to certain drugs. And most importantly, never adjust or stop a medication on your own. Write down your symptoms and bring them to your next doctor's appointment. What seems small to you might be a major clue to your provider. Medication is supposed to help us heal, but in some cases, it also demands that we listen more closely to our body. And sometimes, it speaks in whispers through the skin, the scent, or a strange sensation. Paying attention can make all the difference. Now that we've walked through all 7 personal hygiene mistakes, I hope you're seeing them in a new light. These aren't just about looking tidy or smelling fresh. They are early warning signs, the body's quiet way of asking for help before the situation becomes critical. Sometimes, the smallest details, a missed floss, a thick toenail, or dry skin you dismiss as just age, can hold the biggest clues. These signs can point to heart issues, circulation problems, diabetes, or even cognitive decline. And the truth is, many of these signs show up in your hygiene routine long before they show up on a medical chart. Taking care of your hygiene isn't just about routine. It's about respect for your body, your health, and your future. Every time you brush your teeth thoroughly, inspect your feet, or choose to bathe even when you don't feel like it, you're sending your body a message: I'm listening. Let's not underestimate the power of small habits. Because the truth is, big health changes often begin with small personal choices, the kind that seem minor until they save your life. So here's what I want you to take away today. Take these hygiene signs seriously. They matter more than we think. Start making small, simple changes. Replace your toothbrush, pay attention to your skin, ask your doctor about symptoms you've been ignoring. And please, don't keep this to yourself. Share this video with someone over 60, someone you love, someone who may not know that their morning routine could be revealing something important. When we talk openly about these things, we not only protect ourselves, we help those around us stay healthy, independent, and strong. If you found this video helpful, do me one favor. Click the subscribe button and turn on the notification bell. That way, you won't miss out on more life-saving tips like this, especially ones designed to help you age with dignity, health, and confidence. Until next time, stay well, stay informed, and above all, stay kind to your body. It's been speaking to you all along.